Natasha Knight, and I'm a licensed clinical social worker at Mustard Seed Community Health.
Thank you for speaking with me today. I really appreciate it. So, what is the role of your profession on the healthcare team? And certainly you can give some details in a variety of settings where social work may occur.
My role here is all things related to behavioral health. So that can range from screening new patients to the clinic for behavioral health concerns. That can be ongoing counseling and therapy. That can be case management to address basic needs or more complicated needs. That also is participating on what's called a health outreach team, which is based right here in the community around the clinic, and looking at residents' needs here in the community. So it's a lot of different things that we do here.
Thank you. So what does practicing to the full scope of your education and training look like? So maybe the LCSW, not just the MSW?
So when I think about practicing to the full scope of my license, I think about things that are more purely clinical. So that would be things like clinical assessments and diagnosis of substance abuse and mental health needs, as well as the ongoing therapy part, and maybe risk assessment for suicidal or homicidal ideation. So that's what I think about when I think about the full scope of my license.
Excellent, thank you. What are the barriers to practicing at the full scope of your education and training and licensure?
I would say the biggest barrier is that with the folks that we work with here at Mustard Seed, there's so many needs sometimes before you could even get to those more in-depth clinical needs. So that might be, different basic needs or social determinants of health that are barriers even for them being able to come to counseling. So working on things like housing, transportation, food, safety, sometimes a lot of things have to happen before they're even ready for that next step. So that can be maybe not a barrier, because I think those things are really important too, but those have to be done first a lot of times.
Yes. Okay. What are the advantages to practicing at the full scope of your education and training?
I think that's just, at least for the agency as a whole, that's probably just a good use of my time. Like I said, those other kind of case management or barriers to care are really important to address. But some of those can be addressed also by non-clinical staff here. So for example, some of our interns, or even sometimes the nurse or our receptionist deal with some of those things as well. So I think the advantage to using me for the more clinical stuff is just that it might be a better use of my time, and I'm the only person that can do some of those things here.